Welcome to Inventive Minds Child, Youth, and Family Support Center. We are a not-for-profit organization working with families in their day-to-day parenting by providing workshops and seminars related to pediatric and child development. Inventive Minds provides care in the early years sectors for newborn to age 6, licensed under the Ministry of Education all across Ontario. Inventive Minds carries an elementary school open to international students from junior kindergarten to grade 3. The Inventive Minds Family Center helps families in mediation, arbitration, and parent coordination cases related to family separation and divorce. We support families during and past separation and divorce. Inventive Minds works with court orders to conduct child voice report and parenting courses related to CAS, court, and mediation purposes. To learn more about our services, reach us at inventivekids.com. My name is Rose, the founder of Inventive Minds Family Center. Today we have with us Shawna. We're so excited to have her with us, and we're going to be talking about cavity. And I think that's a very huge topic. And we tend to love our children so much that we might do little things that we don't even realize that could be harmful to our children, and could be to do with food. And that's why I find the topic of cavity to be very important, because whenever I see a little one going to a dentist, I'm like, oh, could have that been prevented? So we hope through this workshop, we'll be able to really dip into these topics and come up with some strategies of how to prevent cavities in your children. Before we start, can you please tell us a little bit about yourself?
Sure. So my name is Shawna Hughes. I'm a registered holistic nutritionist. I work virtually with parents all over the world, but I'm based in Mississauga, just outside of Toronto. I specialize further in ADHD nutrition. I just work with any parent who's looking for a kid's nutritionist, basically.
Wonderful. Before we start today, why don't we go to the basic? Can you define cavity means?
So a cavity in your tooth means it's a permanent damage caused to one of your teeth. Decay presents as either a hole or a wearing thin of a part of the tooth that eventually, if untreated, will develop into an actual hole in your tooth.
What are some signs of cavities in children?
The most obvious one is an actual visible hole. That's usually when people seek help from a dentist, is when they notice a piece of the tooth has gone missing. There are earlier signs, though. So a toothache is a good indication that there might be something going on there, or like swelling around the gums is often a first sign. Sometimes you'll get a white patch before you get the holes. So sometimes the white patches are not cavities. Sometimes it's filled up with fluoride, but sometimes if there's a white spot, especially if it's on the biting surface, that's a sign that a cavity is forming. So what tends to happen is it starts out white and then it goes kind of gray, and then the hole will come and then you've got the actual cavity there. So it's always a good idea, if you notice a weird coloring on your kid's teeth, to have that checked out. Also, so something that happened with my child that's pretty common is if it's in the front teeth, sometimes it's not a hole, but you'll notice the tooth gets like thinner. So the tooth that was this big is suddenly a little bit skinnier because the actual side of the tooth has worn off. So a cavity can happen and actually wear away part of the tooth. So if you're looking at your kid's front teeth and you think, wasn't that tooth thicker before? That's a sign that it's actually decayed a little bit. Also, if your child is suddenly sensitive to hot, cold, or sugars, if they bite into a sweet, a chocolate or something, and they're like, ow, my tooth really hurts, that's a sign that something's up there, something may be starting to decay.
Can you explain examples of practices that parents can cause cavities in their children without even knowing, and how they can prevent it?
So a big one is just too much or too frequent snacking, not leaving enough time between meals or snacks for their child's mouth to do what it does. You know, we have saliva in our mouth that helps to get rid of all the food residue, to get rid of some of the bacteria in our mouth that can cause cavities. Yeah, so just constantly snacking throughout the day and not having that gap of a couple hours at least in between snacks and meals is one of the main causes of cavities, especially here in North America. Kids are kind of always snacking on things. Another one that tends to happen more with really small children, so toddlers and whatnot, is the bottles at night, either milk, breast milk, formula at night. Once they have teeth, that's a risk factor for cavities. And that's another thing that happened to my children as well, is we were giving them too much milk through the night after they were not needing that much milk through the night. And my older daughter got some cavities.
I work very close with the public health, with the school and the children. And actually, a lot of the practices we have as parents, whenever we want to put our kids to bed, we used to feed them milk. That affects the gum and the teeth. Even from infancy, when you breastfeed and you feed milk to your kids, they want you to use sponges to clean the gum.
Yeah.
Because that's going to prevent the cavities for children when they're 4, because that's when you see them mostly going to the dentist and they have to put them to sleep and start pulling out those.
Yeah.
they're full of cavities. A lot of it has to do, as you said, based on milk, and exactly that time is like what exactly you indicated.
Yeah, it's a really hard one for parents because who wants to try and like brush their kids' teeth after they've fed them, put them to sleep? It's a very challenging
thing. That's what you're supposed to do, apparently.
Yeah, so sometimes, as you said, you can just use a little sponge, or they have actual things you can buy to kind of rub the teeth, or even a wet cloth, those little baby. That's what we used to do once your kid's asleep, kind of rub in there. And it's a tricky one. That's probably the hardest one for parents of younger children. If they haven't gotten to the point where they're sleeping through the night without milk, definitely one of the main causes as well. Another one is not starting to brush their teeth as soon as those teeth are there, right? Like you said, it's good to start with the gums before they have teeth. If you're watching this and you're a parent and your kid has like 4 or 5 or even 10 teeth and you haven't started brushing them yet, that's pretty normal actually in our society. Like people just don't start brushing teeth until their kid has almost a full set of teeth, and that can lead to some really early decay. So as soon as you see the little teeth, definitely start to either with a baby toothbrush, which is kind of more of a rubbery, or one of the regular toothbrush for infants that you can buy that looks more like one of our toothbrushes. Just start as much as you can to clean off those teeth after feeding, and especially twice a day, right? Morning and night. Those are the key time. More for older kids, little babies are obviously drinking a lot most of the time, and toddlers as well. But once they're off bottles, when they're just having solids, you want to make sure that they're hydrated, because being dehydrated, having a dry mouth is actually a good environment for bacteria to grow, because not enough saliva, again, is being produced there to kind of wash away the stuff that's coming off of food and onto teeth.
Thank you so much for that. I think that would be very helpful for a lot of families. My next question, what are the key foods to avoid that are strongly associated with cavities in children? Are there certain foods that can contribute to cavities that are healthy or nutritious, things that people are surprised to hear that contributes to cavities?
I think everyone knows the worst things for teeth. It's the really sugary, sticky foods. So things like Skittles, Starburst, caramel, anything that's very chewy and very sweet is 100% going to be the worst for teeth. Just anything that is sweet in general, that's got a lot of sugar in it. So cookies, cake, things like that. That includes juice, right? So a lot of kids now drink juice. And if you're drinking juice, if you're serving juice, you want to make sure that they're cleaning their teeth. So cavities are formed when sugar meets with bacteria. They form an alliance and they destroy your teeth. But yeah, there are other more nutritious things that you wouldn't think would contribute. But one of the main things is really starchy foods. Not necessarily a sweet thing, but even, crackers, bread, potato chips. So things that are very starchy and that tend to sit in between your teeth. You'll notice the things that kind of stick into your teeth. So a piece of bread, so goldfish crackers, you tend to be able to see the little remnants of the flour sitting there on your tooth. There's sugar in it, but certain fruits are more likely to cause cavities. So that would be bananas, because they are starchy and more sugary. Grapes are a higher sugar fruit that you may want to pair with water. Obviously, dried fruits are going to be sticky. Things like raisins and dried up apricots, those are more of a sticky, more sugar-dense food. Anything like that is going to contribute to cavities. These are also the things you want to make sure that you're kind of getting your kid to have a drink, kind of swish water around at the minimum, just to make sure that they're getting some of that out.
Are there certain ingredients to watch out for in processed foods or drinks?
So mainly in drinks, you would find phosphorus. So phosphorus is typically in pop. Yeah, I just skipped over pop in our cavity triggering food section, but yeah, juice and pop. And in pop, you have not just the sugar, but you have phosphorus. And what that does is it kind of competes with calcium. Calcium is good for teeth, phosphorus, not so good. So you want to avoid that. Another thing is citric acid, not in a ton of things that we'd be giving our kids, but just something to keep an eye out for if you notice that something you've been serving them has that in it. Maybe look for a replacement.
Perfect. Which foods should parents include to provide optimal nutrition for strong teeth?
The main one is calcium. Milk is good for teeth. And it's not just milk, though. So you want to include high calcium foods, but you don't need to include just dairy. So obviously things like cheese and milk itself and yogurt is going to have a lot of calcium in them. But there are other foods that are very calcium rich as well. Anything dark, leafy, green vegetable like broccoli, spinach, almonds, tofu, and salmon has calcium in it. And if you're avoiding dairy, I always tell people just really pay attention to the labels on what you're replacing that with. So if you're having dairy-free yogurt, if you're having milk replacements, cheese replacements, just take a look and see that you're not buying things that don't have calcium in them, especially the coconut plant-based dairy alternatives, a lot of that doesn't have the calcium that you find in other ones. I find a lot of people cut out dairy for health reasons, and then they end up with other problems because they've cut out some of the essential vitamins and minerals. Keep in mind, I mean, most kids are eating some fruits and veggies, but vitamin C is also really important for teeth development and health. In the olden days, the sailors got scurvy, which is like extreme vitamin C deficiency. All their teeth would fall out, right? So just making sure they have fruits and vegetables in there. Fruits that are crunchy tend to be better for teeth, like apples and pears. Strawberries are good as well. Those are like the lower sugar fruits.
Wonderful. Thank you for that. Are there ways to lessen the impact of cavity-causing foods?
If they're eating or drinking something higher in sugar, you can try and pair it with a more tooth-friendly food. If they're eating dried up fruit, dried raisins or something, you can try and pair that with something like cheese that's going to dilute the amount of sugar, and it's going to provide the better nutrients there for teeth. If they were eating grapes, you may want to pair that with nuts because, almonds or walnuts, they have a little bit of calcium in them and they're diluting the impact of the sugar there. Another thing just to keep in mind, if they're having something really sugary, just trying to pair it with water, try and encourage that hydration of their mouth to make sure that some of that sugar is getting washed away as they're eating it. And brush, like always. Remember to brush morning and night. And if they have a really sugary treat, try and encourage them to brush after that. It's hard when they're at school. I know like most kids are not running off to the bathroom to brush their teeth after a sweet treat, but just doing what you can when they're in your charge to get them to brush.
Maybe carrying a bottle of water with them after they have their snack, that kind of maybe can help rinse some of it at school.
Yeah, exactly.
So we can maybe promote it with them by having a little toothbrush for them in their bag and having a reward system for them. You had a snack, you brushed your teeth, now you're getting this little sticker or whatever that might work. If your child attending, let's say, earlier center and you bring a toothpaste and a toothbrush, they will carry it and hopefully incorporate it when they're more independent to also do it at school too. Just something we can try.
Yeah, if you speak to the school about it, they will for sure allow that, especially if your child is prone to tooth decay. Most schools are not going to make an issue of it. My child went to a nursery school. They actually did brush their teeth after lunch every day. Yeah, it's a good habit to get into for adults as well. We usually brush our teeth morning and night, but brushing after lunch is also a good habit. I just want to point out, you don't want them brushing constantly though. Like too much of anything is not a good thing.
Thank you so much.
Exactly.
So my next question is, are there supplements that parents should include in their child's diet to help strengthen their teeth?
In general, most kids can take a multivitamin because most kids are not getting 100% of every nutrient every day. I just like to encourage all parents to buy a higher quality multivitamin for their kids, from age 4, especially because most of them are approved for age 4 and up. It's just looking for one with a bit of calcium in it is a good idea. Another thing to look for in a multi would be magnesium. So that's another thing that's really important for bones and teeth. But a lot of us are not getting enough of it. Sometimes people just use a little bit of that magnesium powder, the natural calm magnesium powder for kids. It can be helpful as a sleep aid if your child has trouble settling down at night as well. The thing that's most important is vitamin D. So vitamin D is really crucial for our body to use the calcium. So you can take tons and tons of calcium, and if you don't have enough vitamin D, your body's just going to not absorb it and not use it anyways. Majority of Canadians are vitamin D deficient because we get that vitamin from the sun, right? We get it from having sun exposure, and even in the summertime, it's a good idea to keep taking it because it does kind of build up in our system, and it's good to have that in there. So you can get any brand, of vitamin D. The D drops are fine. You can get a spray now.
How can they get magnesium for their kids?
It's a powder called Natural Calm, and they make one specifically for children. It's powder and you put it in water, and it kind of tastes like lemony berry. It's kind of a fizzy drink, and it tends to help kids with sleep as well. It's good for teeth health. You can get magnesium pills and whatnot, but I find just for kids swallowing pills, you can just get that drink and use it. Just be careful not to overdo it. Too much magnesium can cause diarrhea, and even a bit too much can cause issues there. So,
what's the ideal form of magnesium, and is there anything you should pair it with to increase absorption?
There's kind of a debate in the nutrition world about the best form of magnesium. I don't think it really is as important as other vitamins and minerals. Most of the time, you're going to get magnesium citrate. It's absorbed fine. The one that is absorbed sometimes better is magnesium bisglycinate, is called. It's harder to find. It's usually much more expensive unless you've been advised by a medical professional. I usually just tell people to go with the citrate because to pair it with certain things, not as crucial for magnesium as with other vitamins and minerals. It's not super crucial. Forgot to mention probiotics. Probiotics as well will encourage healthy bacteria to grow in there to fight off that bad bacteria that pairs up with sugar and attacks your teeth. So a good quality probiotic from a health food store or something, not one from just a grocery store. But if you go into a health food store, look for a high potency Kidz probiotic. Good for gut health, but also really good for oral health.
What are your thoughts on fluoride versus non-fluoride toothpaste? And how about the gum that is said to prevent cavities?
Fluoride is kind of getting attacked in the natural health world these days. It's been associated with some adverse effects, which are very unusual, and you'd have to have a lot of fluoride in order for those things to happen. I like fluoride toothpaste. The risk of cavities for children, I think it's downplayed, but it is pretty serious if they have very young and they have a cavity done. Oftentimes they need to be put under general anesthetic in order for the repairs to be made, and they're being injected with local anesthetic. A lot of risks, not serious fatal risks or anything, but risks that you don't want your children really to be exposed to. I'm a big fan of fluoride toothpaste once they're old enough to use it. These health issues that we're seeing linked to fluoride are quite unusual, and you're not ingesting fluoride toothpaste. You're just kind of swishing it around in your mouth and spitting it out. It's one thing to watch out for. Try and make sure your kids are not eating toothpaste. I know a lot of them like the taste. I prefer to use a fluoride toothpaste once your kid is old enough. 100% if you have a lot of cavities in your family. If you've got really genetically strong teeth, you may be able to get away with it. But for a family who's got a lot of cavities like ours, it's non-negotiable, basically. Some of the toothpaste have xylitol in them. Some of the gums now have xylitol in them. It's confusing to explain what it is. And I think it's a good option for some people if that is a real big issue for you. Xylitol, it doesn't have sugar in it, but yeah, it has been shown to strengthen teeth a little bit. As long as they can chew gum and they're at the age where it's not a choking hazard, that's a good occasional thing to give them. And that is also something that you could give to them after a really sweet thing. So that's something that it probably wouldn't be allowed at school, but if they were out, didn't have access to a toothbrush, and they went out for cake or ice cream or some other sweet thing, is something that they could have as an alternative to a quick toothbrush, right?
Our last question for the day is for teeth brushing and flossing in general. Do you have tips to make it easier with young children?
Number one tip is just start really, really, really young. Brushing their teeth, or at least gumming, putting the sponge or the cloth on their gums. The earlier you can get them exposed to that sensation of something moving around in their mouth, the easier it's going to be for you. I mean, don't force them. Keep trying. Start very, very early. In general, there are a lot of different toothbrush options out there. Once or even one, I would try and get them using a regular toothbrush, just because then you're not transitioning from one thing to another thing. It's just from a smaller toothbrush to a bigger toothbrush to make it more enjoyable. But try using one of those songs. So Raffi has a song called You Brush Your Teeth. I don't know if anyone remembers Raffi, I think he's still around, the children's singer. I don't want to advocate for more screen time, but there are tons of 2-minute videos, because you're supposed to brush your teeth for 2 minutes when you have all your teeth. I guess if you're younger and you have fewer teeth to brush, but you're supposed to brush for 2 minutes. And there are a lot of cute little videos out there. One of them is called Brush the Chompers. It's got like a little alien looking guy, and it shows in the mouth how he's brushing each part, and all the green germy guys are being brushed away. It shows you how to brush all the different surfaces of your teeth, which is important because a lot of kids just kind of brush outward facing surfaces, and they forget to get right in there and back of the front teeth and everything like that. And it's just to encourage you to make it a little bit funner. And as you mentioned earlier, using a reward chart is often really effective, especially with younger children. Every time they brush their teeth, they get a little star. So many stars equals up to a reward. Just keep the rewards small, because you don't want to be spending tons of money to brush teeth, and you don't want to be bribing your kids. They start expecting big elaborate toys for doing everyday tasks. And also try and get them flossing early as well, because a lot of little kids are getting cavities in between their teeth. So you can find those little sticks now. They're like a little plastic thing, and it's got a string of floss. Rather than holding the floss, put it around your tooth like that. Often easier for little kids to do. If you can get a really good quality probe, that's the other thing with the vitamin D, sometimes magnesium, but probiotics as well will encourage healthy bacteria to grow in there to fight off that bad bacteria that pairs up with sugar and attacks your teeth. So a good quality probiotic from a health food store or something, not one from just a grocery store. But if you go into a health food store, look for a high potency Kidz probiotic. It's good for gut health, but also really good for oral health. And it's not often, advertised as such. So good to have.
Thank you so much, Shawna.
You're welcome.
Thank you for joining this Inventive Minds Child, Youth, and Family Support Center workshop. Do visit www.inventivekids.com, kids with a Z.com, to learn more about the many other workshops available coming up soon. You can connect with Inventive Minds via email at inventivekids, again with a Z, at gmail.com for any parenting challenges so their professional team can connect with you. Check out a replay of this and many of our other podcasts by searching Inventive Kidz on YouTube and the Parent Toolbox on Spotify. And join the Parent Toolbox Facebook community group today by searching the Parent Toolbox on Facebook. And we look forward to seeing you all again very, very soon.
Have a great day, everyone. Take care.